We speak to Nehawu President Mike Shingange, who joins us for more. A very good evening to you. Thank you so much for your time and welcome to the late edition. Some pressing challenges as we take stock of the value and the critical role that nurses play in addressing healthcare system challenges. Talk to us about what stands out for you as we observe International Nurses Day.
Good evening, Paul and viewers, and thank you very much for having us. And correctly so, we're going to be celebrating the Nurses Day to highlight and commemorate the important role that nurses play. But of course, to take stock of the challenges that they are going through, including the conditions under which they work, which include, more importantly, the shortage of the staff complement, and including the patient to a nurse ratio which said 224 per nurse. Whilst we have got numerous qualified nurses that are roaming the streets unemployed. This, of course, is due to the budget cuts the Department of Health or through the National Department of Treasury. But at the same time, also, the issue of the lack of some resources that are important for the nurses to utilize to deliver service to our people. And that is why we're calling this celebration coinciding with our demand and our call and our campaign for the National Health Insurance introduction, because we believe that the two-tier healthcare system that the country is currently administering is unsustainable. It brings burdens and the burnout to the nurses and many other healthcare workers, whereas they are responsible in the public healthcare system for majority of the population, which is over 85% of the population, which rely on the public healthcare system, but it's under-resourced and underfunded. So those are one of the things that we're going to be highlighting, taking stock of them, and of course, committing ourselves to continue to campaign for the betterment of those conditions.
Let's talk a little bit about the psychosocial traumas of the two-tier healthcare system, which is something that you will be expanding on quite a bit tomorrow as you host your event.
Yes, firstly, because of the shortage of staff, the nurses are compelled to work long hours, and they don't have time to rest. They don't have time to what we call debriefing. In other words, whatever they experience in their work or their duties, they don't have time to be counseled, to have a psychotherapy assistant that every healthcare worker or every trauma worker is deserving. And the fact that when those who are recipients of the private healthcare system or provisions get their medical aids depleted from the private hospital, they get sent while they had already the worst situations to the public healthcare, because that's what the public is supposed to do. They themselves, they undergo what we call a burnout. They undergo some traumas that they don't have time to be depleted. So that's what the thing that we're going to be delving much into tomorrow. Because if you know other healthcare workers, which themselves also don't get, like for instance, the forensic pathologists, the things they see there, that's why you find that there's a high number of sometimes suicide or substance abuse because of the psychological trauma that they go through. We know that the nurses now, as we speak, they have to relieve themselves through what we call a sick leave, because they can't relieve themselves or each other in terms of offs, in terms of leaves, because of the shortage of the staff. The nurses, as we speak today, they don't just have to administer that which is their scope of operation, but they also do other work that is supposed to be done by what we call the support staff, including the wheeling of the patients, including the mopping of the floor, including the sluicing, because of the overall shortage of staff in the public healthcare system and indeed the public service in general.
You talk about the shortage. What we do know is that South Africa only has 22,000 nurses, and it's likely to get worse. What are the biggest hindering factors here? Because we know that there are 5,000 vacant nursing posts that cannot be filled, but it doesn't necessarily mean that there aren't any young nurses who are entering the system and graduating. Budgetary constraints are a massive challenge here.
Well, that's a concern. That's actually the cause of all these shortages. That we will continue to train, but they can't absorb them. But the population is growing. And like I said, the nurse to patient ratio is about 224 that a nurse is responsible for. That's unsustainable. And we have a system that does not invest in the health of the population, because if you don't resource, particularly human resource, in the healthcare system, it means you're going to be unable to deliver by a mandatory, constant mandate to ensure that the population is safe and it's healthy. And that is why the introduction of the national health insurance, in our view, when it's going to abolish the two-tier system that we have, firstly, it's going to have a population that is allowed to receive the healthcare services anywhere from any healthcare facilities in the country, irrespective of whether it's a private or a public, because the resources shall be put into one place, and there shall be funding for all South Africans. Currently, over 50%, which is over and a half of the budget of the health, or the treasury to health, goes to the private sector. The under 50% goes to the public health, which public health services, as I said, the majority, which are poor, who are unemployed, which are black people, 85% of them, they rely on that. But again, the budgetary cuts, which we call as Nehawu austerity measures, actually affects how we resource, affects fill the funded bucket post, which is a most difficult time. As we speak today, when a nurse retires or through any natural attrition, that post doesn't get filled. In other words, a nurse, a ward or a section that was supposed to be looked after by about 7 nurses or even 8 nurses, is actually now been taken care of by about 3 nurses. A nurse in a hospital or in a clinic is supposed to choose sometimes from a bleeding woman who's about to give birth, or a patient who's coming through with a gunshot wound, or with a stepping wound. You have to choose who must live, who must die, simply because there's just not enough personnel to service those patients.
What are some of the bold messages that you're hoping to really address and ventilate as you host your event tomorrow? Because, I mean, this nursing shortage indicates that government's NHI is likely to fail.
No, unfortunately, we will be with the Department of Health, we will be with the South African Nursing Council, we will be with the 2 bargaining councils that are also responsible for the working conditions of the nurses and the healthcare workers in general. There we're going to be holding hands and combining brains on how to improve and transform the public healthcare system. However, our bold messages, rather other than or over and above praising these brave soldiers of the nations who braved the death and watched their colleagues die, including those of their family during COVID-19 when everybody else was on lockdown. It's a time for us to sit back and actually take a pat them on the back of their shoulder. But at the same time, we're going to insist that now than ever before, the national insurance must come into place, and we don't think it's going to fail. If all the contents and the provisions of the bill as it stands now, that has been now passed by the National Assembly and the SOP, it cannot be failed because the bill doesn't provide that you must perfect the system first before you introduce the NHI. Actually, the bill contains the issue of human resources. It contains the issue of availability of medications and other working tools. It also contains the issue of the infrastructure so that we can reduce the long queues that are found in the hospital. So that's, for us, it's a solution, because that NHI is going to resolve even the issue of the shortage. It's going to resolve private and public services, but it's also going to resolve the issue of resources, which is financial, human resource, and also medication.